Etiology, the first is the physiological enlargement in childhood at the age of 6 years. We all know that there is enlargement of adenoids at the age of 6 years, mainly in certain children who have the tendency to generalized lymphoid hyperplasia, and in that case adenoids also takes part in that. Not all children will undergo physiological enlargement of adenoids in childhood, but there are certain children who have tendency to generalized lymphoid hyperplasia, and then adenoids also takes part. Some other causes are recurrent attacks of rhinitis, sinusitis, because the adenoids is located behind the nose in the nasopharyngeal space. So any infection in the nose like the rhinitis, sinusitis, chronic tonsillitis, they may cause adenoid infection and hyperplasia. Then allergy of upper respiratory tract. If there is allergy of upper respiratory tract, then also the child is predisposed to adenoiditis. So the clinical features, coming to the clinical features, signs and symptoms of adenoiditis depends upon absolute size of adenoid mass and available space on nasopharynx. So enlarged adenoids causes nasal, oral and general symptoms. Oral means ear, nasal symptoms like nasal obstruction, nasal discharge, nasal obstruction, because the adenoids will enlarge in the nasopharynx. As a result, that will cause nasal obstruction and the child have to breathe through the mouth, and breathing through the mouth will lead to difficulty in feeding and suckling, because the child will not be able to take food and breathe at the same time. So the child will not thrive, not grow much. There will be nasal discharge, and because of nasal obstruction the child will breathe through the mouth. So mouth breather will lead to phases called as adenoid phases. Nasal discharge, because nasal discharge will occur because there will be obstruction, because there will be nasal obstruction in the nasopharynx part. So there will be chronic nasal discharge. There will be wet bubbly nose. The nose will always be wet, and also there will be rhinitis. Since there will be rhinitis, so there will be nasal discharge. Then sinusitis. This is like a vicious circle. Chronic sinusitis will lead to adenoiditis, and adenoiditis may lead to sinusitis, that is maxillary sinusitis. Then epistaxis. Nose blowing may result in epistaxis and voice change. There will be, since there is nasal obstruction, so there will be no nasal tone in the voice. So here is the specimen of an adenoid mass. So this is a specimen of adenoid mass after removal with curette. Note the ridges of lymphoid tissues separated by deep clefts. There are some clefts here which separates the lymphoid tissue of this adenoid mass. So we have discussed up to the nasal symptoms. Now coming to oral symptoms. Oral symptoms means symptoms in the ear. Since the adenoid will enlarge in the nasopharyngeal space, I am showing here. Since the adenoid will enlarge, it will block the eustachian tube present here. As the adenoid will enlarge, it will block the eustachian tube present in the nasopharynx, and that will cause the tubal obstruction. Eustachian tube obstruction. Adenoid mass blocks the eustachian tube, leading to retracted tympanic membrane and conductive hearing loss. Then recurrent attacks of acute otitis media may occur due to spread of infection through the eustachian tube. Since the eustachian tube will be blocked, and the infection and the bacteria present in the adenoid mass may travel into the inner ear and may cause acute otitis media. Then chronic suppurative otitis media may fail to solve in the presence of infected adenoids. Then serous otitis media. Now coming to the, so this is the child having adenoids. You can see adenoid faces. Patient is a mouth breather. Adenoid faces, patient is a mouth breather. The child will breathe through the mouth. As a result, there will be the nose will undergo atrophy, pinched up nose and hitched up lips. So these are some general symptoms. Adenoid faces, chronic nasal obstruction and mouth breathing leads to characteristic facial appearance called adenoid faces, and the child has an elongated face. Child has elongated face and mouth will remain open and the lip is hitched up. So these are some general features, and other general symptoms are pulmonary hypertension. Because adenoid hypertrophy, there will be no long-standing nasal obstruction and there will be less oxygen going into the lungs. The lungs have to supply more oxygen to the tissues. As a result, there will be pulmonary hypertension and cor pulmonale. Then lack of concentration, aproxia. Aproxia means lack of concentration. The child will have less concentration in studies and all. Diagnosis is done by examination of postnasal space is possible in some young children, but adenoid is usually not seen through the mouth. But sometimes it can be seen with a mirror. A rigid or flexible nasopharyngoscope is useful to see details of the nasopharynx in a cooperative child. So in diagnosis, nasopharyngoscope is used. Soft tissue lateral radiograph of nasopharynx will reveal the size of adenoids and also extent to which nasopharyngeal space has been compromised. So radiograph and nasopharyngoscope in case of the diagnosis. Then treatment are some breathing exercises, decongestant nasal drops, antihistaminics. This is the symptomatic treatment doesn't work, we will have to do some adenoidectomy. So treatment, breathing exercises, decongestant nasal drops.